Hello, my name is Dr. Laura Tigler. This YouTube channel is intended to give you some good medical information. I will also include some spiritual information at the end of each video. If you don't want to listen to the spiritual information, you can just stop once I'm done with the medical information. This YouTube channel is intended to give medical information only. It's not meant to give you specific medical advice. So please see your doctor and have a good relationship with your doctor so that you can get good medical advice that's tailored to exactly your needs. Okay, that all being said, let's get started. So today I'm going to talk about chronic kidney disease. So that's a disease of the elderly for the most part. And I want to break down what chronic kidney disease is. If you are younger and you're listening to this video and you have an older relative or friend who has chronic medical conditions, then please pass this video along to them and please like and subscribe. Okay, so today we're talking about chronic kidney disease. Chronic, it just means that the disease or condition is present over time. Kidney means that it's affecting your kidneys. You have two kidneys. Disease is a little bit with a negative connotation. I'll give you that. It might have been better to say chronic kidney condition, or even more descriptive, chronic kidney damage. That would have been probably a better description. But it is called chronic kidney disease. So what is chronic kidney disease? It means that there is some damage to your kidneys, and it is present over a period of time. It's permanent and it can progress. Most often, the damage is caused by a long-term relative elevation of sugar. So even if you don't have full-blown diabetes mellitus type 2 or diabetes mellitus type 1, which will, by definition, mean that you have chronically elevated sugar in your blood whenever we check your blood. You could have pre-diabetes, and that means that your A1C test result, I'll explain that later, is not normal, but it's not high enough to designate you with the diagnosis of diabetes mellitus type 2. So for those patients, we put them in a label called pre-diabetes. I know I'm not talking about diabetes specifically today, but to give you a bit of information, the pre-diabetes condition does mean that you have a risk to develop full-blown diabetes mellitus type 2. Generally speaking, if you have pre-diabetes, there's about a 30% risk that you will go on to develop full-blown diabetes mellitus type 2. So I'm talking about sugar for a couple minutes now because that's one of the main reasons that people get damage to their kidneys. So elevated sugar in your bloodstream causes damage to mostly the proteins in your body. Think of it like molasses, the glucose in your bloodstream, and pretend that my hand is sticky syrup or molasses, and it sticks to proteins in your body. And it might stay there or kind of come and go, but overall, on the average, your proteins have a higher percentage of their surface area that have sugar molecules stuck, and it makes it so they can't work very well. So it causes damage. So elevated blood sugar is one cause for chronic kidney disease or chronic kidney damage. Another very common reason that we can have chronic kidney disease is our blood pressure is elevated. So generally speaking, if the blood pressure, when you're at rest, and you're sitting at rest for about 5 minutes, if the blood pressure is greater than 120/80, that's abnormal. So if your blood pressure is only a little bit elevated, but every time you check it, it's a little bit elevated, we call that pre-hypertension. And I'll get into more details with another video on how we diagnose and treat hypertension. But even pre-hypertension, just like pre-diabetes, carries a risk to do harm to your kidneys over time. And if you think about that, that makes sense, doesn't it? Because if the pipes in a house there's a lot of pressure in there, eventually they might burst or cause damage. So if the blood pressure in your body is typically greater than 120 over 80 when you're sitting and resting, then, and you're using a arm cuff, not a wrist cuff, but an arm cuff, and it's the correct size for your arm, then that's causing or could cause damage to your kidneys over time. Let's say you have hypertension, and that means that your blood pressure is consistently greater than 140 over 90. Then that's an obvious and definite risk for chronic kidney disease. Those are the two main reasons that we get chronic kidney disease, but there are other reasons. For example, we're learning in recent years that when women have certain complications of pregnancy, say elevated blood pressure or preeclampsia, then that can damage their kidneys. If you think about it, that does make sense because we're pregnant for about 9 months, and if the blood pressure is elevated for a period of time, then that's doing damage. But it's not as simple as that. Preeclampsia has other reasons why it can cause problems for our organs, especially the liver. But if you have complications of pregnancy, that should, or you had complications of pregnancy even remotely, because I might be speaking to patients who are elderly, then you do need to bring that up to your doctor and specifically ask that you be checked for chronic kidney disease. So I went over the definition of chronic kidney disease. It means there's damage to your kidneys over time. Now, switching from your perspective to a doctor perspective, how I diagnose chronic kidney disease is I do assess whether or not the patient has risk factors. So I'm doing blood work. They themselves might be checking their sugar. They themselves might be checking their blood pressure. And if they have elevated sugar or elevated blood pressure, for sure, I know to check for chronic kidney disease. I actually treat seniors now. For the first 21 years of my practice, I treated all ages, but now I treat elderly, age 65 and older. And almost by definition, almost all of them could be at risk of chronic kidney disease. So I am quite attuned to checking for chronic kidney disease. So there's a couple ways to go about that. Of course, you want your blood pressure checked and your sugar checked. But you also want to have your doctor check urine. There are 2 different urine tests that I routinely order: albumin-creatinine ratio, and that specifically looks for whether or not your kidneys are demonstrating that they're damaged. And then urinalysis. Almost everybody has had a urinalysis test in the course of their lifetime when you've interacted with doctors. And that typically, I think patients think of that as checking for infection, but there are many different conditions that we can check with the urinalysis, and one of them is to see if protein is slipping through, because the kidneys should be holding on to good things and filtering out the bad things. So the kidneys are a very sophisticated filter, and glucose and protein generally, you would think that the kidneys would try to keep that in your body. And then the kidneys want to get rid of waste products. So your cell, each cell in your body has good things going into it like oxygen and bad things going out of it like carbon dioxide. And that's true of waste products too, of metabolism. So the kidneys are a sophisticated filter. So if I see protein in the urine, that's giving me a clue. There's another thing that I could see in the urine that will give me a clue that you might have damage to your kidneys, and that's hyaline Cas. Basically, you don't have to even remember those 2 words. Basically, it's like sediment. And so the fluid coming out of the kidney should just be like water. It's your urine, a bit colored water, right? And there shouldn't be sediment in it. Now, you might not notice any sediment, of course. It's not grossly apparent, but when we do the urinalysis, we can find some kind of sludge. Think of it like that. Don't use the word sludge, please. That's not accurate. Cas, or to think of sediment. So that's telling me there's damage to your kidneys. So I'll be doing 1 or 2 urine tests for you periodically. And then sometimes throughout the course of our medical lives, we might have a CT scan of the abdomen and pelvis. And that might show damage to the kidneys. The radiologist might say something like cortical thinning, or they might say something like damage to the kidneys. And that right there is proof that the kidneys do have damage. So chronic kidney disease just means there's obvious damage to the kidneys and it's persisting over time. So that's the explanation of what chronic kidney disease is. I'm going to go further into treatment, and I'm going to go further into stages with videos that are coming soon. But right now I wanted to give you an understanding of chronic kidney disease, CKD. Okay, we've reached the end of our medical portion of this video. I'm just going to give a few, maybe a couple minutes of advice on spirituality. So I am a devout Christian. I am not trying to proselytize or turn anyone into anything, but I have observed over time with my patients that those who are have something meaningful in their lives, like close family ties or a belief in God or a devotion, and they try to discipline themselves and be better. That alone is going to help them lead happier and healthier lives. But I do have to say, I do have an opinion that it is best, of course, to be kind to others. And it is good to love others, even your enemies, like Jesus said. But my main goal in this portion of the video is to tell you that if you're not saved, then you're lost. And I know that's hard to hear. I am personally saved. When I was saved, I did not know that I had previously been lost. So that's why I'm just opening, hopefully your ears and mind are open and you can see that or hear someone say that very clearly. And how you get saved is you have a relationship with Jesus Christ. I personally think it's important to go to church on a regular basis, learn everything you can, read the Bible again and again and again. I have written a couple books, and the first book is basically theological in nature. It's nonfiction. The second book is fiction, and it's just a fun story with a hero that happens to be a woman of faith. But I am going to read a brief prayer, just randomly chosen out of my first book. It is called You're Saved, and it is by me, Lara Tigler, MD. You can get it on Amazon. So each chapter is informative, and I ended the first chapter, as I did almost every chapter, with a prayer. Dear God, thank you for my life. Thank you for the gift of grace that you freely offer. I know that my life is a gift of grace. It is your prerogative to offer that gift. It is your sweet mercy that sustains my life. Give me the wisdom and faith needed to praise your holy name day and night. Let me always give glory to God. Let me accept your gift of salvation for now and always. Let my soul be renewed each day in faith and wisdom, so that I may go out into the world with your peace which passes all understanding. Amen. I'll see you next time.